yesterday. It looks like there are 4,727 total positives in Ector County. 3,095 of those are confirmed, with 1,632 probables. The active cases are 625. The recovered is 4,006. Deaths, there have been 96. And I know this is a number that everybody's been asking about as well, the positivity rate. So positivity rate is at 17.31%. Russell, do you want to go over the MCH numbers today?
Yeah, good afternoon. Can you hear me okay?
We can.
Okay, great. Hello, everybody. I'm traveling in the region today, so I'll be joining, of course, by phone, and then I'll hand it over to Kristen. But at Medical Center, we have had 1,506 positive cases. Currently today, we have 31 COVID patients in-house. 23 of those are on 8 Central, and we also have 8 in CCU. So that's 23 on 8 Central, 8 patients on CCU. In the CCU, 3 of those are vented, so 3 on the ventilators today. Our COVID patient list from out of the Ector County is pretty extensive today. Let me run through that. We have 1 from Focus Care of Odessa, 2 from Deering's of Odessa, 1 from Alpine, 2 from Crane, 1 from Midland, 4 from McCamey, and 1 from Rankin, and 1 from Ward County. So if you add those up, 13 of our 31 COVID patients today are either from the nursing home or from out of county transfers. So that number is 13. We have 5,448 negatives with 14 tests pending currently. We have no suspects in house. We know that in house they're either positive or negative. And so far, Medical Center has tested 6,968 patients total so far. So with that, I will hand it over to Kristen and let her give you any updates she has. Kristen, go ahead.
I think just a reminder for everyone, we know obviously from us having 30 plus in our building that COVID is still out there. So I would like to make sure the community remembers, please continue to be cautious of where you're going, mask up, use your hand hygiene, your distancing practices, just because you might not have anyone around you that has been exposed or has it. It's still trickling in all around our region and within Odessa Midland. So very important to stay vigilant. I just wanted to give positive kudos to the emergency room staff. All of the visitation is going very well down there. People are very appreciative of being able to come in to see their loved ones or be with them until either discharge or going up into one of the inpatient units. They've worked really hard to make that a smooth process down there. So we appreciate the community's support, your patience, and actually many people come in with masks already. So we appreciate your compliance with all of those things that we're doing to keep you safe while you're in our emergency room. And past that, Trevor, I think we're good. I don't have anything else.
Okay. I just got some nursing home numbers sent to me by Brandy, but I'm going to go ahead. I want to send it to Stacy and Dr. Sarah Vannon first. We go over ORMC numbers.
Thank you, Trevor. Odessa Regional has tested 3,392 patients. 455 of those are positive, no pending currently. That gives us a positivity rate since we started testing earlier in the year from the beginning at about 13.4%. Our positivity rate for the last week is down quite a bit. It's down to 4. And I think if I recall correctly, we spiked at about 20 late June, early July. So we are seeing it come down a little bit. But again, as Kristen pointed out, it's certainly not over, and it's out in the community, and it's certainly out in the surrounding areas as well. So we need to continue those cautionary efforts. In terms of what we have in-house, we have 4 patients in-house. 3 of those are in the ICU, with 2 of those on a ventilator. Of those 4 patients, 2 of those are from Big Spring and 2 from Ector County. So that's all I have, Trevor.
Thank you, Stacy. Dr. Sarah Vannon.
Thanks, Trevor. A couple of things to add. In addition to the positivity rate within the hospital, the one other positivity rate we can look at is the city's free testing that they restarted last week. So they were able to do about 97 or so tests last week, and their positivity rate was also about 4%, which is much lower than when the last round of cities testing was. They took a little break for a few weeks in between, but before, maybe a month ago, their positivity rate was 14%. Now it's down to 4%. So that's a positive sign with regard to positivity rate in the community. It's hard for the county to release a true positivity rate for the whole county because they would have to have the information for every test done in the county. So they have to have all the negative tests and all the positive tests, total number of tests, before they can release a positivity rate. That's much more difficult for them to do in real time. That's why I'm giving you the positivity rates in sort of smaller groupings, like here at Odessa Regional, maybe at the city, and then maybe at Medical Center, we could give, little pieces of the positivity rate. The visitation policy is one of those things that we are trying to stay consistent on. So Odessa Regional was also able to adjust the visitation policy. We're allowing that one visitor in the ER and one visitor for the people that are having surgery, in addition to the exceptions that we had before. The strict no visitation policy is kind of still in place for the remainder of the hospital, but we added those two new exceptions for ER and for surgical patients. Lastly, I do want to talk about the flu season coming up, and that flu shots are now widely available. There are also options to get free flu shots in some places. I think one of the ones I saw floating around from a chamber mailing list is by calling 211 and asking about that program. There are certain people that would actually qualify to get that free flu shot based on their income levels. So I would encourage you to reach out for that. It's not through the health department, it's through another grant program. I don't have the full details on that. I can get it for you guys for next week. But the flu shot is important because, again, I've said this before, that's one of the viruses, one of the two viruses that are going to be affecting us over the next few months, for which we already do have a vaccine. And it's been proven time and time again that it works. So there's no reason not to get it. So I would reinforce that although we're continuing to wear masks, and that'll help a lot with all respiratory viruses, not just COVID, but also the flu, getting the flu shot in addition would be very helpful in making sure that we maintain a low disease burden so that hospitals don't get overwhelmed with flu admissions in addition to possibly COVID admissions. So that's all I had for now, Trevor, unless anybody has questions.
Go ahead. Real quick before we get to questions, Brandy from the health department did send me some updated numbers from all the nursing homes. I know that's a level of concern for people here. I'm just going to go over these real quick. Buena Vida in Odessa currently has 14 active cases. They've had 72 recovered and 10 deaths. Deering's in Odessa has 13 active cases, 76 are recovered and 15 deaths. Focused Care has 7 active cases, 23 recovered and 7 deaths. Siena has 1 active case, 60 have recovered with 15 deaths. The Parks has 4 active cases with 7 recovered and 1 death. And Madison has 3 active cases, 13 have recovered and 0 deaths. So that was a nursing home update from the health department. Let's go ahead and get to media questions. And it looks like first one up on the list is Danny.
Howdy. Can you hear me?
Yes, sir.
Dr. Saravanan, do you think that with the numbers kind of being kind of flat right now, that maybe would you suggest that the economy kind of start opening up and start including bars?
That's a good question, Danny. We have to understand that the reason we were able to flatten the curve to where it is now, flat doesn't mean 0. Remember, flat just means not actively rising. Okay, so to answer your question, the reason we were able to flatten the curve is because of the precautions we have in place. So I wouldn't say we should turn back the precautions and allow for a wider reopening, because then that we would go the opposite way and we would start increasing cases again, especially places like bars where it's very hard to social distance or wear a mask when you're at a bar. Those are one of the things that we have to be careful about reopening. So I would not encourage widespread reopening of businesses that cannot follow the precautions. I do think that businesses should reopen. Our economy should get back to as normal as it can be, but it should be done with those precautions in mind, especially masking and social distancing. And I'll add also that the masking and the social distancing is what got us here. That is something we cannot go back on, even if we choose to open more of the businesses.
Russell, do you have something to add too?
Dr. Saravan, I appreciate those words. I think you're right. I think we have to remember that the masking is what is keeping, just like you talked about a couple of meetings ago, in the Southern Hemisphere, it's winter and they're going through flu season, and that their flu rates look better because they're masking. And that although we all are Texans and we all enjoy our Texas freedom, but to wear that mask is not only protecting you, but protecting the next person, and to make sure that we keep those masks on. And I think that that's smart business. And other than that, Trevor, I'm sorry, guys. I'm on the road. I need to step away so I can be safe. And y'all, please wash your hands and stay safe. And I'm going to sign off.
Thank you, Russell. Danny, do you have a follow-up?
Yeah. The reality of having a vaccine like this year, do you feel confident that that could happen? And what about the safety of the vaccine if it does happen to make it before the end of the year?
Yeah, I think that's also a very good question, because what I do think will happen with our cases that we're seeing now, I think this is the norm of cases that we're going to have in our hospitals, in our community for the next several months until we do have a vaccine in place. What we see now is probably what's going to continue, unless there's some big spike in certain districts or in certain institutions. I don't think we'll see big spikes happen again. It'll be as it is now. So, about 20 cases or so that are sick in the hospital, and about 50 cases or so per day that might come up in the community. That'll continue on a daily basis. So to answer your question about the vaccine, the reason that's important is because that's when that norm will change. It'll go back to being, well, hopefully a few days in a row with no new cases. And that'll happen when we have mass vaccination. Now, do I think a vaccine could come out by later this year? Sure, it's possible. But there's two things to consider when we're talking about a vaccine. One you asked about, and that's the safety and the efficacy. You've heard me say this before as well. A vaccine is not a medication that you're giving to a COVID patient to help them get better. A vaccine is something you're giving to someone who is not COVID positive, who hasn't had COVID, and you're preventing them from getting sick. So your level of efficacy and safety for a vaccine has to be much higher than a medication that you're trying to approve to treat someone who's already sick with the disease. You'll have a lower threshold for the medication, much higher threshold for the vaccine. So we cannot rush a vaccine. And so I'm not of the mindset that vaccines need to go through a fast process to get approved, because there could be compromises that are made with regard to safety and efficacy. I would prefer that it goes through a full phase trial. Right now we have a couple of vaccines in the phase 3 trial. I would prefer that we go through the full trials, look at the data very carefully before we mass produce and distribute. And that brings me to the second point you didn't ask about, is the timing. Even though a vaccine could come out later this year and get emergency use authorization, we still have to think about mass production and distribution. If you look at what the government did so far, Danny, the government went ahead and placed large pre-orders for vaccines from these companies. That's why the big funding to each of these companies, in hopes that one of these companies is going to come up with an efficacious, safe vaccine that's going to get approved by the FDA, and then they can ramp up production very quickly and get it to the masses. But even so, it will only be for those high-risk individuals. It'll be for maybe healthcare providers, maybe people who have those disease conditions we talked about early on that are high risk of getting very sick from COVID. Those are the people that are going to get it. So for the whole population to be vaccinated and for us to roll back precautions, I don't think that's going to happen until the end of flu season, probably in the spring of next year.
All right, that's all I have. Thank you, Dr. Saravana.
All right, thank you, Danny. Up next, Jared. Do you have anything, Jared? No. Okay, Marcos. Up next, there we go. We got Mike Merlot, Odessa American. You're muted, buddy. You're muted, Mike.
Good, thank you. I guess my question is about the accuracy of the county positivity rate. So do more negative tests need to be reported for that to be more accurate, and who needs to report those?
I don't think it's just about more negative tests being reported. I mean, positivity rate by definition is the number of positive results divided by the total number of tests done. So it doesn't matter if the negative cases per se more are reported. We need an accurate count of total number of tests being done in the county. And that means every single entity, every single provider that's performing these tests would need to report in, hey, I did X number of tests today. Because what they are doing so far, hopefully, is that they are calling the county and letting them know that these are the positives. Well, that's good because they need to do contact tracing. And so that part's happening. And that part was pushed pretty hard early on. But the total number of tests, I'm not sure if every single provider is reporting the total number of tests, which is why it's hard for the county to release a true positivity rate. What you see on the county's website is the cumulative positivity rate for historical, right? From the beginning of this disease up to now. But if you go now and say, can I get a 1 week positivity rate or 2 week positivity rate? Well, no, they can't, because they don't know the denominator, the total number of tests that are done, which is why I was telling you, I was giving you the information just about ORMC testing, just about city testing, because that we have control over to say, hey, this is how many tests total were done, and this is how many turned out positive.
Right. So I guess a problem would be that certain providers, if someone tests negative, that test wouldn't be reported at all.
Well, yeah, that is my guess, is that there are certain providers or certain groups that do not even report any tests to the county. And so the county doesn't have a count of that. They may get the positives from those people, but they won't know how many tests total were done. So the positivity rate at that point would be meaningless.
Okay. Yeah, and that was just, I guess, because we've been talking about the county positivity rate for a while. So I guess it's important for people to know.
Historically, if you think about for over a period of time, let's say the labs that report to the health departments of total number of tests that they ran from this county, well, that historically will give you a good cumulative positivity rate. Again, what I'm trying to say is a 1 week positivity rate or a 2 week positivity rate. That's what's hard to get.
Right.
The historical rate is accurate. The hospital's historical rate, I think, Stacy, wasn't it 16% or so, or something along that lines when we looked at from the beginning of this disease process to now?
Yes, it was over 17% cumulatively, if not closer to 20, quite frankly. I think we almost hit 20.
Yes, so you see that's pretty consistent with what the positivity rate reported on the county's website is. So cumulative positivity rate is a believable number because historically they can collect that data from many different sources. It's just real-time collection of total tests done is what's difficult.
Okay, and is part of that, due to certain backlog as well?
No, I would say it's mostly because of lack of reporting of certain by certain providers to the health department. Okay. The hospitals are reporting in, and some of the providers in the community are being very good to report in as well. But the county doesn't have control over every single provider.
Right. Okay. Well, thanks, Doc. And I guess, is there any updates to, I guess, places like the hospital, cafeterias, or gift shops, or things of that sort? Are those opening? Are those closing? How y'all doing with that?
At this point at Medical Center, we're still not allowing people to come into. Our gift shop is open and our cafeteria is open because we have staff here in the building, and we do have some visitors in the building, but it's not open for people to just come in and out, or outside people come in to eat, anything like that. It's still pretty restricted because we don't want people congregating in those areas.
Okay.
That's
Perfect.
essentially the same at Odessa Regional.
Okay. All right. Thank you. That's all the questions I have. So appreciate it.
Thanks, Mike. And last one up is Scott from CBS 7.
Good evening or good afternoon from the Music City Mall. I wanted to ask all of you, when that first batch of vaccine gets to the hospital, are you going to be comfortable getting the shot?
So that's a preemptive question, Scott, and I'll speak to you as a scientist, as I always have, is I'd have to look at the evidence at that point. I'd have to look at the study that the FDA released before it issued that emergency use authorization. And you asked a very personal question, so this is not me advising the community. This is me telling you how I would evaluate personally, how I would choose to or not choose to get that shot, is by looking at that study, looking at the N, which is the total number of people that are in the study, looking at the power of the study. It's a statistical variable that you can look at, and then deciding, okay, do I feel comfortable with the FDA's group of experts that are physicians like myself, sitting there deciding, should this go through authorization or not? Was there any political influence in getting this authorization through sooner than it should have? Those are the kind of skeptical questions that I would answer for myself. And without question, I would advise the community the exact same thing. So my advice now is, let's wait and see. Let's not push for a vaccine just to come out fast. Let's push for a vaccine to come out safe and effective. And that's us as a community telling our government that's what we want. We want a safe and effective vaccine. We don't necessarily want the vaccine tomorrow, but if you could give it to us in meaningful time frame and still be safe and effective, that's what we're looking for. Hope that answered the question, Scott.
Yeah, and let me ask you a tougher question. If when that paperwork and that documentation and that shot comes out and you're not comfortable taking it, what would you tell your patients? And what would you tell a patient who says they want it anyway because they want to hurry up and take the vaccine?
Yeah, and that's a good question, but that's no different than any other discussion doctors have with their patients. So if I don't feel comfortable with a certain treatment process, my patient's going to know that I don't feel comfortable with a certain treatment process. They may bring up something that they want to discuss. I am their consultant. I am their healthcare consultant, their advocate. So I'm going to give them the information that I have. I'm going to teach them what I know. I'm going to give them my opinion, and we're going to make a shared decision on what treatment that person's going to receive. That is their right as a patient. So I would respect that and give them the information they ask for, and then it would be a joint decision whether they want to take it or not.
And Stacy, when they come out and it's for first line responders like your staff, would it be mandatory to take it or optional?
I don't know that that's been decided yet. I'm sure that decision will be led largely at the corporate level from our corporate quality team. And so we'll be getting guidance on that as it gets closer to being released. I really can't say at this point, Scott.
That makes sense. I appreciate that.
And Scott, I can add a little bit more to that, because eventually what will happen is when this vaccine comes out, there is still going to be a % of the population that chooses not to get the vaccine. What's going to happen is that you're going to walk up to a restaurant and you're going to want to go in, and they're going to ask for two things. They're going to ask for your ID to check your age, and they're going to ask for a card that you did get your vaccine before they let you in. So that's the norm that we're going to look for in the future. So even though the vaccine is considered safe, effective, and recommended, and there are still a % of the population that choose not to get it, well, there will be loopholes that you would have to jump through to actually get things done because you're choosing not to be safe when the rest of your community is choosing to be safe.
You really think it'd be that strict? Show me your papers kind of thing?
Oh, I was, yes, that's a fair question. I don't know, but I was being facetious and giving you that as a possible scenario that we could look at in the future. Most definitely, if you're going to book an airline ticket, I wouldn't be surprised if the airline said, well, we will not let you fly unless you got the vaccine. So that is a true possibility.
And finally, I just wanted to ask all of you your opinion on Halloween. What's your expert opinion, and tell the parents at home how you feel about trick-or-treating this year.
Well, it's an outdoor activity, Scott, and I think it can be done very safely if we can social distance and still wear masks. So I would still encourage us to all celebrate. Don't congregate, don't go in big groups, still wear your costumes, go out and have fun, and do it in the safest way possible.
I'm going to put that as a bumper sticker: celebrate, don't congregate. Kristen, do you agree?
I do. We need to get back out there, and most people, they're out and about in the open air anyway. So just wear your mask and don't crowd on the porches and those types of things. I do agree. We need to continue.
Do masks need masks?
Sure. Put a mask on the mask.
Thank you, guys. I appreciate you.
Is that everything, Scott? All right, that should be everything. And I think that's the meeting. So perfect. We will be back again next Thursday. Does anybody have any closing words?
I have Psalms 34:8, Trevor. Okay. Taste and see that the Lord is good. Blessed is the one who takes refuge in him. I hope you guys have a great week.
We'll see you next Thursday.
Thank you.
Thank you.